Good afternoon, everybody. This is Anthony with the Wrench Out Experiment. Thank you for tuning in, liking, sharing, subscribing, all of that. It does mean a lot to us. Today is March 28th, 2020, and this is your COVID-19 update coming from Alaska. Look into this. All right, guys. So once again, thank you for tuning in. I'm Anthony. This is the Wrench Out Experiment. I've been doing these videos almost daily, and I say almost because last weekend I did not do them, but I'm trying to kind of keep up with things and do it pretty much daily. Yesterday was a really tough day. I did do a video earlier in the day prior to the governor's announcements and some of the other information that had come forward. So today we've got definitely some big news to discuss and go over. First, a very sad situation happened because of COVID-19, and we did lose our first Alaskan at the Alaskan Native Medical Center. I believe the age was 60 years old, and it's a very unfortunate situation. So we, our heart and condolences and everything is out to them, the family, and anybody else that's dealing with a loved one that's really handling the COVID-19 or coronavirus here in Alaska and really anywhere for that matter. So just wow. We are up to 85 cases, which, stuff's growing pretty rapid here in the state. A big difference, though, that I don't know people really understand because our numbers are relatively low compared to the other states in the United States, of course. Obviously, our communities here are a lot more rural, spread apart, and they're not large communities with the exception of Anchorage, Fairbanks, Juneau areas. That pretty much makes the bulk of our population with just those three cities, and Anchorage taking its weight from the other two pretty dramatically. So, sitting at 85 and then its continuation to spread, I would guess that by Monday, we're going to be over 100. Now that is a guess. It's not any kind of game, but I would guess that's where we're at. So with that being said, there's obviously some new mandates that had come out, and that's what we're going to talk about today. But before I dive into that, as I discussed yesterday in the end of my video, it is a weekend, guys. So please take some time, get outside if you can. I know it's not very warm. I was just out there for almost an hour with the kids. We went on a walk. We did see a couple of other people, but we did keep our distance. So we are on the Alaska Department of Health and Social Services site. As I've said several times over, I encourage you guys to go there. Of course, I review a lot of that information and what I hear both from the public videos that come out, whether it's Trump or Governor Mike Dunleavy and Mayor Berkowitz there in Anchorage and wherever those sources are. So today we are going to read some of those things. One of the big things I encourage you to read is the Health Mandate 11 and 12, social distancing and intrastate travel kind of Q&A that they had. They did a really good job, whoever put this together from the state, on kind of answering some of your questions. I may go into a little bit of that, but let's just dive into the mandates. So let's see which one we've got up here. So we're going to start with Mandate 012 or Mandate 12 from the SOA March 27th COVID-19 health mandate. And this is the intrastate travel. Okay, to prevent the spread of coronavirus or COVID-19, the state of Alaska is issuing its 12th health mandate based on the authority under the Public Health Disaster Emergency Declaration signed by the governor. Given the increasing concern for new cases, let's see, will go in effect March 28th, 2020, 8 a.m. So by the time you're watching this is already in effect and will be reevaluated April 11th, 2020. Now, these dates on all these mandates are very important because if this does impact you, you want to pay close attention. This mandate is issued to protect the public or Alaskans. The goal is obviously to flatten the curve and stop spreading the virus. That's really the mandate for, that's really kind of the mission statement, I would say, for all of these mandates. I know that there's different perspectives and you've got your opinions, I've got mine, but really the goal here is to reduce that curve or reduce the increase of the coronavirus. So I'm going to go kind of quick through this. So the state of Alaska and the Alaska Department of Health and Social Services acknowledgement the importance of minimizing interstate travel to avoid introducing new COVID cases to communities. We want to slow the spread, which is imperative that Alaskans heed these guidelines. So critical infrastructure is vital to keeping Alaska safe, and as a result, businesses and employees of critical infrastructure industries must, to the extent reasonably feasible, take reasonable care to protect their staff and operations during this pandemic. And then there's some information down there as far as contact and whatnot. Let's go down. So Health Mandate 12, limiting travel between communities to critical infrastructure or critical persons needed, effective 8 a.m. This is kind of the crux of it. There's a couple paragraphs. I'm just going to rip through them. So all in-state travel between communities, whether resident, worker, or visitor, is prohibited unless travel to support critical infrastructure or critical personal needs. Certain small Alaskan communities may implement further travel restriction based on, the Alaska Small Community Emergency Travel Order Attachment B. Personal travel is prohibited except as necessary to meet critical personal needs or work in critical infrastructure jobs. Critical personal needs include buying, selling, or delivering groceries and homes goods, obtaining fuel for vehicles or residential needs, transporting family members for out-of-home care, essential health care, or purpose of child custody exchanges, receiving essential health care, providing essential health care to a family member, obtaining other important goods, and engaging in subsistence activities. Travelers are reminded to follow social distancing measures, including the extent reasonably feasible, keeping 6 feet away from each other, avoiding crowded places, limiting public gatherings to less than 10 people, which we've talked about before. No one traveling to or from any community for critical reasons or critical personal travel may be subject to any automatic quarantine or isolation on arrival except as allowed under Alaska statutes or health mandates. All carriers and other travel-related businesses have no duty to verify the intrastate travelers meet the criteria for permission. On this health mandate, air carriers shall inquire if travelers are permitted to travel under the mandate and shall rely upon a traveler's assurance that they are eligible to travel. This mandate supersedes any of the local government or tribal mandates, directives, or order restricting interstate travel. So that's what's happening right now. So I feel like at this point, if you didn't expect this was coming, you really haven't been paying close attention to the news and see what's going on. Now, one thing that I've changed kind of my thoughts and opinions, especially over the last few weeks, is the severity of this. Now, there's this huge kind of ridiculous debate on the flu versus COVID and so forth and so on. I'm not going to dive into that today, but know this. I mean, COVID-19 is spreading rapidly. We have to do our part to try to prevent that. in the event that your community gets it, whether it's a small rural community or a larger rural community, or the Matsu Valley, or wherever it is, it doesn't matter. It's going to wreak havoc on those with poor immune systems. In some cases, elderly, but there's been reported cases of children, teenagers, 20-year-olds, 30-year-olds that have been affected, and we've lost some of those folks. So I understand that influenza is dramatic and it also kills people and this and that, but influenza can be treatable, and there's a lot of other differences between the two. I'm not going to go into that. Let's dive into health mandate number 11, social distancing. So again, it's got close to the same header. It's effective March 28th, 2020 at 5 p.m. and will again be reevaluated on April 11th. We're talking about the mandate 11. Same goal, same purpose. Let's walk through this now. This is a little bit longer, so just bear with me, and then we'll prep to wrap this video. But the governor orders individuals to abide by the following: work from home as much as possible. See Alaska Essential Services and Critical Workforce Infrastructure Order. Immediately isolate any family member who is ill. And there's a link to what looks to be some kind of coronavirus guidance. Outdoor activity, walking, hiking, bicycling, running, fishing, and hunting is permitted when a distance of 6 feet or more can be maintained between individuals not in the same household. Now, not in the same household is kind of the key running explanation through all of the mandates and through a lot of the social distancing. Just because you know your buddy and they say they've quarantined doesn't mean they're not carriers, and vice versa. So keep that in mind. Moving on, any individual who exhibits symptoms of illness must not leave their home, including to work, except as necessary to seek or receive medical care. Pretty straightforward, right? All individuals shall cease participation in public and private gatherings that include non-household members, regardless of the number of people involved. This includes, but is not limited to, weddings, faith gatherings, graduations, and funeral events. Individuals experiencing homelessness are exempt from the mandate but are urged to obtain shelter. Okay, so part 2, non-essential businesses, and then there's a part 3, and then I think we'll get this done as quick as I can. All businesses within Alaska, except those listed in Alaska Essential and Critical Workforce Infrastructure Order, are required to cease all activities at facilities located within the state, except minimum basic operation as defined in Section 2C. For clarity, businesses may also continue operations consisting exclusivity of employees or contractors performed activities at their own residence working from home. For purposes of this mandate, covered businesses include any for-profit, nonprofit, and educational entities, regardless of the nature of the service, this function they perform, or corporate or entity structure. Need a drink of coffee. All right, let's keep going here. Minimum basic operation includes the following: providing that employees comply with the social distancing requirements as defined in this section to the extent while carrying out such operations. The minimum necessary activities to maintain the value of the business's inventory, ensure security, process payroll, and employee benefits or related functions. Okay. The minimum necessary activities to facilitate employees of the business being able to continue to work remotely from their residence. Okay. Part 3 to this, governor orders employers to abide by the following: businesses providing essential services and critical infrastructure will, to the extent reasonably feasible, take reasonable precautions to ensure the health of their service sector and employees Public-facing businesses providing essential services and critical infrastructure will proactively promote social distancing between employees and others, including but not limited to expanding delivery options, drive-through services, limiting the number of individuals in a building, clearly spacing lines to keep individuals 6 feet apart, or making appointment times to minimize interactions between members of the public. Employers will evaluate each of their employees can feasibly work remotely from home to the extent reasonable. Take steps to enable employees to work from home. A violation of this cease order could it result in a civil fine of $1,000 per violation. A bunch of codes, a bunch of stuff down below that, guys. So that's it. I know this is a longer video. So that is Health Mandate 11 and Health Mandate 12. So 12 is the interstate travel, and 11 is the updated social distancing. Where obviously, you just need to stay home unless you absolutely need to go to the store. Don't go hang out with your friends. Don't go hang out with your family outside of your home. Stay home. If you know of a good hiking trail or what have you, by all means, get outside, go to that hiking trail, but just make sure that you maintain a 6-foot distance between those folks that aren't in your household, and you should be okay. Now, we once again have 2 weeks of time on our laps here. The sole purpose of all of this, I do truly believe, is to hopefully cut the curve, cut that climb, because as you know, over the last 2 weeks, we're climbing up that mountain with quite a few confirmed cases, and we had our first in-state Alaskan loss of life, and it's tough. Obviously, no one wants to get this or should want to get this, so you have to take those steps, those necessary steps, to make sure these mandates are guidelines to help. And then obviously you still need to wash your hands. Make sure that if you are in a public area, you go to the store, what have you, when you get home, sanitize yourself, take your clothes off, wash those, etc. Take as many precautions as that you feel fit. But me personally, and what we're doing here at my house is we're taking every precaution that we possibly can, because I don't want to get infected. My wife doesn't. My kids don't. There's no rhyme or reason to put yourself in a position to where you may get infected that you're in control of. Now, obviously, there's a lot of things you're not in control of. The air in any of these locations could easily be passed. Could pass the coronavirus over to you, and then obviously as a result of that, you would get ill. The gas pump, it could be anything. I'm not going to go down that rabbit hole or that chase, but please do your part. So the question for the day, people here, especially the Alaskans that are watching this, or if you're not and you want to pipe in, feel free. What are your thoughts on both Mandate 11 and 12, social distancing in the interstate travel? I gave you my clear opinion kind of through this video. I know it's a longer one, but they're two significant mandates that I feel is super important for you to understand what it means. Again, there's a Q&A. I'll put links to this stuff down below, so please take some time, go through these, get familiar with them, or at least understand them. Make sure to share them with your friends or family members, especially those that may want to still venture out and just kind of screw around out there. So let's be our brother's keepers in this case, and any other case that we need to keep going down that road. So, all right, guys. So again, it is Saturday, March 28th. I appreciate you guys checking out the videos. I'm Anthony. This is Rent Start Experiment. Make sure hit subscribe, give it a thumbs up. I appreciate it. And we'll do another video tomorrow. All right. You guys have a fantastic day. Be safe out there. And we'll see you then.